What are you hearing from nurses about the state of their workforce?
State of the workforce. So as we know, going into we have a 10% shortage of nurses, and that really is geographically different. So if you're in urban settings, you're feeling the shortage, but not as much as you are in those rural settings. And so still hearing from a lot of nurses in rural areas that the shortage, of course, feels like it's getting worse. The stress of everything that's going on, well-being, workplace violence, you know, makes the feeling of turnover even greater. So it feels like nurses are having issues continuously, and we're not really making a lot of headway on that.
What is driving that? What are some of the factors at play?
No, absolutely. So, workplace violence continues to be an issue. So, nurses are more likely to have to be abused or have an incident than police officers or correctional officers. And 75% of workplace violence is happening in healthcare settings. And I wish I had an understanding of what's going on in the public, because that's really a big driver is where people used to not think about coming into a healthcare setting because a healthcare setting is supposed to be a healing environment. People are coming in angry, frustrated with the system, and nurses are getting the brunt end of that stick of that frustration with our overall healthcare system. So we really do need to focus in and hone in on solutions, because that just further impacts turnover and the stress that nurses are feeling in the work environment.
And that violence and aggressive behavior seems to be across nursing. A lot of it's in the emergency department, it seems, and emergency nurses are very right to say that doesn't make it acceptable by any means. But we're also seeing in other elements of the hospital as well, it seems like.
No, absolutely. Whether it's in maternity wards, it is in outpatient clinics, home care agencies, it's just across the board. So there's really not one area that's exempt from it.